Hello and welcome to the NC HMIS 2015 AHAR Prep webinar. This webinar is presented by the Data Center at the North Carolina Coalition to End Homelessness. NCCEH is the HMIS local system administrator for the North Carolina Balance of State, Wake, Orange, and Durham County CoCs. In this webinar, we'll briefly describe the AHAR report, its data sources, and the AHAR reporting categories. There is a lot of work to do, so in item 4, we'll talk about data quality and what's needed to have usable AHAR data. We'll close with a plan for AHAR submission for the CoC staffed by NCCEH, and then we'll end with questions. What is the AHAR? The AHAR is an acronym for the Annual Homeless Assessment Report. The report is provided to Congress and contains information about the extent and nature of homelessness in the U.S. It is the central resource for national data on homelessness and includes 420 CoCs nationwide. The AHAR provides an understanding of who is homeless and how homelessness changes over time. It does this by estimating how many people experience homelessness in the U.S., their service use patterns, and the community's capacity to house them. The AHAR also estimates the number of people residing in PSH and provides characteristics about them as well. Nationally, AHAR data is pretty significant. It can be used to inform the public and help policymakers craft appropriate intervention strategies to prevent and end homelessness in this country. But the AHAR is also very important for North Carolina. This data can help your community better understand who is homeless, how homelessness changes over time, and the service needs of people experiencing homelessness in your community. The data can also be used to inform local homeless assistance planning and to inform the public. At NCCEH, we think the AHAR report is really cool. So here we provide an example of the kind of data the AHAR report provides. So in this image, you can see that 50% of U.S. homelessness is concentrated in 5 states. It's California, New York, Florida, Texas, and Massachusetts. Just an example of the kind of data that can be found in the AHAR report. AHAR data sources. AHAR data is pulled from 3 places: HMIS, the point-in-time count, and the housing inventory chart. Hey, I hope you're listening because I'm about to say something that's really important. Your HMIS data matters. Seriously, we can't stress enough just how much your HMIS data matters. The AHAR report is built on the UDEs you enter for your clients. Elements such as gender, race, ethnicity, vet status, entry date, etc. It's also really dependent upon the project descriptor elements you entered for your project at migration. These would be things like project type and bed and unit inventories. Client-level HMIS data is included in the AHAR submission. The AHAR looks at data entered between October 1 of 2014 and September 30th of 2015. That's a 12-month period. Then it filters for any person who entered a residential housing project, such as emergency shelter, transitional housing, or permanent supportive housing during that 12-month period. Data about individuals, families, and vets who entered a residential housing project between October 1 of 2014 and September 30th of 2015 will be included in this year's AHAR. Some HMIS data is not included in the AHAR submission. So homeless people who only use a supportive service program during the 12-month period will not be included. People in shelters that serve victims of DV will not be included, and people who do not access any type of homeless residential program also not included in the AHAR. The AHAR also includes the point-in-time data we submitted to HUD earlier this year. Remember, the pit is a snapshot of homelessness on a single night in late January. This data includes information about unsheltered homeless populations and subpopulations, such as chronically homeless, vets, and people with HIV/AIDS. AHAR reporting categories. One really important thing to know about the AHAR is that it counts people by household type. So in the AHAR, a family is denoted as having at least one person over the age of 18 and at least one person under the age of 18. All other household types are considered individuals. So, an example, two married adults who enter as a couple in a shelter are treated as two individuals in the AHAR. Another example, a child who enters a project that serves unaccompanied youth is also counted as an individual in the AHAR. Previously, I mentioned the three residential project types included in the AHAR. They are emergency shelter, transitional housing, and permanent supportive housing. For reporting, each of these types is broken out into two groups, families and individuals. There is a family and individual category for each project type. This yields a total of 6 reporting categories. It's 2 per project type. In the next few slides, we'll describe how we determine what data goes into what reporting category. If you are a shelter that served only families in the reporting period, your data should only be in the ES family category. If you're a shelter that served only individuals, your data should only be in the ES individual category. Emergency shelters that served both individuals and families will have their client data split into the 2 appropriate reporting categories. If you are a transitional housing project that served only families during the reporting period, your data should only be in the TH family category. If you are a transitional housing project that served only individuals, your data should only be in the TH individual category. Transitional housing projects that serve both individuals and families will have their clients' data split into the 2 appropriate categories. Lastly, PSH. So, if you are a PSH project that served only families from October 1 of 2014 to September 30th of 2015, we should only find your data in the PSH family category. If you are a PSH project that served only individuals, your data should only be in the PSH individual category. If you are a PSH project that served both individuals and families during that reporting period, your client data will be split into the 2 appropriate categories, and you'll see your data reflected there. Vets are included in the AHAR reporting categories we just mentioned, but additional data about homeless vets is requested in a separate AHAR submission to HUD. The data elements and reporting categories are the same, but only include data about adults ID'd as vets in our HMIS. AHAR data quality. In the AHAR, each reporting category is evaluated for usability. Usability is based on a few different items, but here we want to focus on coverage, utilization, and overall data quality. Coverage asks, are the majority of the beds in a certain category on HMIS? As a rule, at least 50% of the beds in any category have to be on HMIS for that category of data to be considered usable. For example, if your COC has 100 shelter beds for individuals, but only 30 of those beds are on HMIS, the data is not usable. At least 50 of those beds would have to be on HMIS to have the data accepted by HUD for the AHAR. Utilization rates must fall between 65 to 105%. We find that programs that report that less than 65% of their beds are being occupied are failing to enter all clients served into HMIS. On the opposite end, we find that programs that report that over 105% of their beds are utilized are failing to exit clients who are no longer receiving services from HMIS. And then lastly, overall data quality is reviewed by HUD. They expect a low rate of missing data. They expect the data to be accurate and be consistent across time. To have usable AHAR data, it must be cleaned prior to submission. NC HMIS recently experienced a huge transition, and as a result, our HMIS data needs quite a bit of work. So we really need all hands on deck for this effort. This includes COC leads, NCCEH data team staff, agency admins, and all project staff. In the next few slides, we'll review common errors and how to resolve them. Agency admins need to review project data and make corrections each week leading up to the final AHAR submission. A big red flag for HUD is the rate of missing data. This happens when UDEs are not entered into HMIS at the appropriate data collection points. You can find missing data by running the 0252 Data Completeness Report Card in ART and reviewing the data on the Client Detail tab. To fix this error, you will need to review the client file for information, or if you still have contact with the client, you can ask the client. You'll want to be sure that the information you collect from the file or the client was true as of the client's original entry date into your project. If you are able to get the information and confirm this, you can go ahead and enter that data into HMIS. You will want to call the NCCEH data center to enter static data elements such as social security number or vet status. You cannot edit these items for your clients once a client profile is created. And just a note to not ever email social security numbers to us. Please call to give us that information. I also just want to stress that missing data is always better than inaccurate data. If after reviewing the client file, you find the information is not there, do not make anything up and put it into HMIS. Just leave it blank. There are times when missing data is okay, and this is one of those times. If you can't find it, we don't have it, it's missing, it's fine. If you ever have any questions about that, please call us. We are happy to talk to you about this. In October of 2014, HUD verification was implemented in HMIS for the disability, income, benefits, and health insurance sub-assessments. An error occurs if data entered into the sub-assessments is not verified. You can find this error by running the 0252 Data Completeness Report Card in ART and reviewing the Client Detail tab of this report. To fix this error, you will need to review the client file for documentation, and that could be receipt of TANF, SSI, a doctor's note for disability, or a pay stub for employment. And again, if you have contact with the client, you can also ask the client. You'll want to be sure that whatever documentation you find was true as of the client's entry date into your project. And if you're able to get this documentation, you can enter that data into HMIS. Again, we want to stress here that missing data is better than inaccurate data. And if after reviewing the file, you can't find documentation, do not make anything up to put into HMIS, just leave it blank. Before we get into the details of this issue, I want to note that child-only households are not in error if your project serves unaccompanied youth. If your project does not serve unaccompanied youth, the enrollment of a child-only household is usually considered an error. So this happens when a child is not attached to the entry of the head of household. To find this error, we will contact you. NCCEH Data Center staff are running reports to identify children who are enrolled in projects alone, and we'll contact you about correcting this error. To fix this error, usually the unaccompanied child's entry must be deleted in HMIS and recreated on the head of household's entry. Unexited clients is a common data quality issue. This happens when projects do not exit clients no longer receiving services. This negatively impacts the utilization rate and length of stay for the project and the COC. To find this error, you can run the 0216 Unexited Clients Exceeding Max Length of Stay report in ART. To fix this error, staff will need to review the client file or consult with other staff to determine when the client actually left the project. Next, you'll need to exit the client from the project in HMIS using the exit date found. If no date is found, contact the NCCEH Data Center. We have some best practices established about when to exit clients, and there's no information available. AHAR data is really important. It's needed to address and end homelessness. So we want to put forward as much effort as possible to ensure a strong submission. To do this, agency admin action is required immediately. Right after this webinar, you should run the 0252 report, review it for data quality issues, review client files, consult staff, and make the necessary changes in HMIS. We also need you to review your bed and unit inventory for accuracy. Remember to never delete inventories. Add an end date and create a new inventory. Please call us before making any changes if you are unsure about how to correct your bed and unit inventory in HMIS. Another report to run right after this webinar is the 0216 An Exit Client Report. Again, review it for quality. So if you're a shelter with an average length of stay of 30 days and you see a client who has been enrolled for 2 months or more, ask questions, review client files, consult staff to learn more about that client stay. If you learn it's an error, get the information needed and make the necessary corrections. The AHAR plan. The data center at NC is leading the AHAR work, which includes data cleaning, communication with APT, and HDX submission for Wake, Balance of State, and Orange County COCs. Durham County is taking the lead on its own AHAR submission, but we are always here to support the work. So call us if you ever have any questions about your data quality or submission. Here we've listed the ongoing AHAR tasks performed at the data center. So once a week, starting 10/26, next Monday, we'll send an AHAR update to COC leads. This update will include an overview of usability for each reporting category, feedback from APT, communication, and work with agencies. Beginning 10/30, draft AHAR data will be submitted to HUD each Friday. As always, we are here to assist with data cleaning 9 to 5, Monday through Friday. Agency admins are critical to having usable data for the AHAR. The tasks listed in this table will help you get in good shape. Once per week starting today, please run the 0252 and the 0216 reports in ART. Both reports should be run again anytime edits are made in HMIS. We also need you to review your bed and unit inventories for each of the projects at your agency. This week, we will be comparing the bed and unit inventory in HMIS to the housing inventory chart submitted by your COC. We need you to review this, but if there's any variance, we will contact you to make sure the corrections are made in HMIS. Lastly, we will be emailing and calling a lot to discuss data quality and reporting in general. This is a team effort, and we really need you to be responsive to our communication. This is our 2015 AHAR timeline. Today kicks it off with the AHAR prep webinar. Again, right after the webinar, please go run the 0252 and 0216 reports in ART. Continuing on October 26th and every Monday thereafter, an AHAR update to COC leads will go out via email. Starting next Friday, October 30th, AHAR draft data will be submitted to HUD each Friday for feedback. And then on December 11th, we'll submit the last AHAR draft. Finally, on December 16th, the final AHAR submission is due to HUD. And then you can see to the left of the timeline, data quality work is ongoing the entire time. Before we open up for questions, I want to note our contact information here on this last slide. We can be reached at 919-410-6997 or at hmis@ncceh.org.